pain, and the infection and inflammation is going to... Hi guys, it's Dr. Carter at Lexington Podiatry, and according to my cute little patient here, he has a really gross toenail, but it's something we see all the time, so not so gross to me. Let's take a look. He got ran over by a cart. They are very dangerous, so you have to be careful. A lot of times when you have an injury to the toe, the skin swells up and it can cause a minor ingrown toenail to turn into this. We've already got him numbed up. We've already got him cleaned with betadine. We're gonna squeeze his toe and put the tourniquet on real quick. And then I'm gonna test him to see if he's numb. I don't think he is. We may have to put in some more, but that's okay. All right, sweetheart, do you feel that? Good. How about here? And how about up here? Okay, so a little bit up there, and I can see, I don't know if you guys can see it, there's a little bit of pus coming out there, and a little bit in here just from me squeezing on it. Okay. We're gonna do a little bit more numbing down here. He's really happy about this. The tourniquet makes the numbing medicine work very quickly. Did you feel that? We're gonna go pretty fast with this just because where he's already numb, he doesn't feel it very much. There's a chance Bobby may fall down. All right, a little bit more numbing. I'm just gonna put it all in there because I don't want him to feel this. Because it's so inflamed, it neutralizes my numbing medicine. And that's one reason that it may not work as well. Also, there's genetic factors that can play a part in it. And just kind of what you're used to. All right, let's test again. How about here? Do you feel that? Mm-hmm. How about here? Yeah. Okay. Not as bad as you did before? Mm-hmm. All right, we're gonna give it just a second. Have a seat. We don't need Bobby to pass out.
They'll love being this close.
I know. All right. So you start to notice some color turning. It looks purple, deep red. That's just from the sheer amount of pressure and fluid in there. We put a lot of numbing in a tiny little area. Okay, let's see if you can feel this. Nope. How about here? Mm-hmm. What does it feel like? Sharp or pressure?
Sharp.
Well, we're just gonna keep trucking along. Sometimes we have to let them just sit for a few minutes, but I like the tourniquet approach better. The tourniquet feels terrible on. That's one of the things people complain about the most is how that feels. Do you feel that?
Just at the tip of the toe.
Okay. Anything here? I'm not going to start, I promise, until you're done. I'm just going to scratch this off, and I'll test you again in a second. I hear so many horror stories that the patient will tell the physician that they still feel it, and the physician says, there's no way you can still feel that, and they just keep going. That is something I would never, ever, ever do. Some people take more numbing medicine than others, and it's not my job to determine how much that is. All right. Can you feel that?
I don't think so, not now.
How about here?
I feel like it may be just pressure now.
Okay. I'll get started at any point. I can always stop, okay?
Okay, I'll move this way.
I mean, I was going to let you help. All right, so this piece of puffy tissue here, it does bleed a lot on contact. Are you okay if I talk?
Yeah.
Okay. All right, guys, let's get this loosened up. It already looks better just by getting that scab off there. That helps a whole lot. We're gonna go down in and loosen it. We're gonna come under it at the top, and we're gonna clip. Now, we're not putting chemical on him today. We are just getting rid of this piece of nail causing this infection. If I attempt to put the chemical on there to keep the toenail away for good, it's going to blow up on him and cause significant pain. And the infection and inflammation is going to neutralize the chemical as well, and it'll never work. All right, that's a pretty good one. Looks like a shark tooth. We're gonna tell people that a shark bit him, and that's what happened. You still good?
Yeah.
Okay. I had to take a slightly larger section because this tissue is so puffy, and it's not the normal case where I can just clip it away. So we took a little bit more, but it's gonna clean up really well. Afterwards, he's gonna soak this in some Mod Pod Epsom salt, the Relax product. He's gonna use a collagen gel on it for speedy healing, and he's gonna secure it with a Polymam bandage. All of those things ensure that this heals as quickly as possible. All right, it's over, my dear. It does bleed a lot, so if you don't want to look yet, I was going to put a dressing on it. Usually we let you sit here for a couple of minutes to make sure that it doesn't bleed through. I don't want you walking out of here and leaving a trail of blood behind. It kind of scares people off. Katrina, would you grab that needle and fix? All right. Perfect. Okay. So there's one thing we always do that ensures that it heals really well. And when I do this, I've never had one not heal on me. Perfect. All right, guys, there you have it. A cool ingrown toenail on a sweet young man. Stay away from those carts. Have a good day.